Hi, my name is Tony. I'm a surgeon here at Southwest Tech. I'm going to be working with you today. I'm doing some muscular things and some looking at your skin and some things like that. Is that okay?
Yep.
Okay, good. Wonderful. Let me go over here and check out the orders here. What was your name?
Kayla Flesh.
Kayla Flesh. Very good, Kayla. What's your date of birth?
5/3/97.
Excellent. Any allergies I should be aware of?
Nope.
Okay, very good. And I can check your wrist there. Excellent. Okay, I'm going to be wearing gloves for part of this procedure here. So, we're wearing a little hand sanitizer and get our gloves. Alright. Just get a little privacy here for you. While I'm putting my gloves on, can I have you hold your arms out there? Okay, all I'm doing here is I'm just checking for any tremors, fasciculations, or contractions. Okay, and you're pretty steady. You're pretty steady. That's great. Thank you very much. That's easy enough, right? Okay, first thing I'm going to do is I'm going to look at your scalp. So kind of working from the top down here. And all I want to do is we're just feeling the scalp here, making sure it's kind of symmetrical. There's nothing majorly out of line or any large bumps or anything like that. I'm not seeing anything there. We're looking for just checking the skin for lesions or anything that might feel or be out of order a little bit. Do you have any concerns with your scalp?
No.
Okay. And the third thing I'd like to look at is just check behind the ears and at the nape of the neck there and make sure we don't have any infestations or anything. And that all looks really, really good. Your hair itself looks nice. It's shiny. It looks. It's got a nice texture to it. It's a nice even brown color. It's evenly distributed. Kind of a fine to a medium texture, and it looks really good. So, and it looks really good. And I'll check it on this side also. It's medium. It's even distributed, and it's got a good texture. And it's brown, and it looks good. Okay, I'm going to take my gloves off here now. And we'll be looking at your skin. So what I want to do here, the first thing is just kind of feel. And I'm going to feel good. And you're good, and it's not clammy or anything. It's warm. It's got even pigment distribution. It's warm and it's dry to the touch. And I'm just going to check this out over here also. Same thing. You got warm, dry to the touch, even. This is a nice coloring. Check the legs here also, nice and pink. Good coloring. And when I look at that now, I'm going to kind of move back up on you here. But I'm also checking for what we call phlebitis, which is an inflammation of maybe any of the veins that might be in there. So I'm looking at your leg for that. And that would be like could be warm red veins. Check your arms here also for that. That looks good to me as well. Okay, I do see you have a macula here. It's less than a centimeter wide. It's not raised up or anything. It's got even edges, and it's basically just a fancier word for a freckle. So you're good to go that way. We might just document this and just make sure it doesn't change over time. So that's good that way. Yeah. So overall, we got good skin color and good skin color and what have you. So I'm going to one thing I am going to do. I'm going to kind of pinch you on the chest here and make sure it bounces back right away. And what we're doing there, that's called turgor, and that is just a sign of whether or not you have enough hydration in your body. And it looks good, you do. So we'll do that also. So the next thing I'm going to do is look at your fingernails. And I'm going to do this with both hands and both feet. And all I'm doing is I'm checking here for a couple things. We want to make sure that they're nice and kind of concave and rounded. The skin on them looks good on both your hands here. There's no sign of dishing. There's no sign of clubbing, so we're good that way. And the other thing that I want to do with your fingernails is just to give them a little pinch and see how fast they fill back up. And that's called capillary. We're checking to see how fast your capillaries fill back up. And it's a sign of good circulation. So when I do that, yeah, we're less than a second on those. Again, skin integrity looks good. Concave, no dishing, no clubbing. And we're less than a second as far as your as far as your capillary refill goes. Do you mind if I take your shoes off?
No.
Okay. So I'm going to be doing the same thing with your feet here. I see you've got some nail polish on. That's not a big deal. We can still do that capillary check. A little bit slower down here, but you're still, I mean, if it's a full second, it's a long time, and we got up to 3 seconds. Nails look good. I don't see any signs of ingrown toenails or anything. They're nice concave shaped. I don't have any concerns with that. And here as well, we've got good capillary recharge. Nails are in good shape. Don't see any signs of imperfection. No dishing or no clubbing, scooping or clubbing. So yeah, so it looks good. Do you have any concerns with your, okay. While I'm down here, I'm also going to check, since you're in a seated position, I'm going to check it for what we call edema, which is swelling. And we just kind of get a little poke on the skin there. And I'm not seeing any time it's bouncing back right away. Now, if we did have a little issue with that, there is a scale that we have. So if it goes in and stays in 2 millimeters, we call it a +1. 4 millimeters is a +2, 6 millimeters is a +3, and 8 millimeters is a +4. But we don't have any problem there, so that's all good that way. Okay. So I want to go through and make sure that I'm done with all of your skin stuff. And the next thing we want to do is I'm going to look at your, just what we call palpate. So I'm going to palpate some of your major joints. So what I'm going to do, I need you to tell me whether or not you feel any pain or not. And I'm just going to push on some of these joints. And I'm feeling for any hotness or swelling or anything on that way. So if you could just tell me, I'm going to go through your joints, but you tell me whether you feel any pain.
No.
Okay.
No.
Okay. How about this one?
No.
Good. Over here?
No.
Okay, I'm going to push on your hip here.
No.
Okay. And same over here.
No.
Okay. Good. I'm going to get your knee here. Nothing. Okay. Your knee here.
No.
Good. And your ankle. Nothing. Okay. And again, I am feeling for any sort of heat or swelling, and I did not feel any heat or swelling in any of them as well. So I think we are okay that way. Okay, let's see. The next thing that I'm going to have you do is we're going to go through your muscles. Since we've got all of your skin stuff done, we're going to look at your skin and integumentary system. Now I want to just go through it and check some of your muscles. Okay, so the first thing I need you to do is to move your head for me. I'm going to put pressure on, tell you how to do, have you put pressure on my hands and that. And I'll explain things kind of as we go along. So the first thing I want you to do is put your hand on my head and push with your face this way. Good. And over on this way. Good. And that checks your muscles on your neck there. So next thing I want you to do is I'm going to be pushed down on your shoulder, and you can push up. Good. And that checks your trapeze muscles. And the next thing I do is have your arms out. I'm going to push down, and this checks your deltoids. Right here. Very good. If you can move your arms like this for me, I'm going to pull on both of these, and that's going to check your biceps. Good. And I'm going to push. And that's your triceps. Very good. Now if you can put your hands up like that, I'm going to push against your wrists, and you push back. Okay, good. And then I'm going to pull. Good. All right. If you can open your fingers for me, and then you resist. Good. And good. All right, very good. Very good. Okay, so I'm going to move down here, and we're going to do your legs the same kind of way. So I'm going to pull first, and that's going to check your glutes back here, or your hamstring muscles. So good. And then your quads are up here. Excellent. I'm going to pull your hamstring. Good. And then resist quads. Excellent. All right, now we're gonna have you do what they call dorsiflex or lift up with your foot. Good. And a plantarflex, which is pushed out. Excellent. All right, have you lift up with your foot, dorsiflex, and down, and plantarflex. Very good. Very good. Okay, I think your muscles are looking okay there. So we're getting towards the end of our what we need to do here. But if I could have you stand up, we're just going to look at your back here quickly. And what I'm looking for here is just a nice symmetry of your back. And looking to see we got a nice straight spine. There's no sign of scoliosis. There's no big dipping up on top, which is the ketosis. And your lordosis of your lower back looks good as well. If I could just have you bend over for me, I would appreciate that. Good. No scoliosis, no ketosis, no lordosis. That's excellent. Next thing, if I could have you walk for me, I would appreciate it. Okay, you got a solid base, a nice even stride, and a steady gait. If you have a seat there, okay. I'm going to document all of this over here. Okay, good. Do you have any other concerns, or is there anything I can get for you while I have time?
Nope, I think good.
Okay, very good. You've been a great patient.